Good morning. We're here today with the National Carbon Monoxide Awareness Association. The speakers will introduce themselves now. Sharon, will you kick it off?
Good morning. I'm Sharon McNabb, President and founder of the National Carbon Monoxide Awareness Association. Very happy to be here today talking on this very important subject.
I'm Steve with 4C Marketplace. We'll be promoting the conference. You can find a recording of this on the YouTube page. Okay, so Sharon, if you'll lead in with the introduction, and then we'll get to the rest of the bios.
Yeah, so I am Sharon McNabb with NCOAA, and we very happy to be here. Richard, would you like to go next?
Sure. My name is Richard Heller, former Senior Vice President, General Counsel of Legal Seafood, and now currently, after the sale of Legal Seafood, currently principal in Pineapple Hospitality Consulting Group, a consulting business providing soup to nuts services to the hospitality industry, focusing on legal strategies and mitigation strategies.
Mark, would you like to go next? Or Kevin?
Good morning. I'm Kevin Sehlmeyer, the Michigan State Fire Marshal, coming to you from the state of Michigan. And I've been the fire marshal here in the state of Michigan since April of 2017. And excited to be part of this much needed discussion on this topic.
And Mark, I'm sorry, you'll have to unmute yourself.
Maybe Roger, would you like to go next?
Sure. Roger Berkowitz, former president, CEO of Legal Seafoods for 46 years before we sold this past December. We operated restaurants in 9 states, 30 restaurants in 9 states. We also operated a seafood processing plant and a mail order operation. And I'm happy to share my experience, and hopefully it'll be educational to some of those listening about what happened with a carbon monoxide incident several years ago.
And I can go next. My name is Garnet Schulte. I'm part of Molex. I'm the global account manager for the SpencerCon product line. And I'm happy to be here and excited to talk about some solutions that we have.
Mark.
And I'm Mark Pung. I'm with NCOA as Vice President. I'm glad to be here supporting Sharon in this very important initiative and look forward to the discussion today.
Okay, I think first and foremost, it would make sense to go over a couple of slides to talk about what exactly is carbon monoxide. Carbon monoxide is one carbon atom and one oxygen atom. It's produced by everyday fuel burning appliances and equipment. Air pollution is classified as a class 3 toxic gas. Adults typically breathe about 15 to 20,000 liters of air per day. And when polluted air is inhaled, it contaminates the lungs, it enters the bloodstream, and is carried to internal organs, causing adverse health effects. And evidence suggests that every internal organ is harmed by carbon monoxide. There are 2 different types of carbon monoxide poisoning. First is acute, and that's a single exposure at high doses. It's detectable with a blood test and treatable with hyperbaric oxygen. Chronic is a little different. It's poorly recognized. Most people don't even realize that you can get carbon monoxide poisoning from multiple exposures to low doses, and there's really no detection or treatment plan for it. And the poisoning can last up to months or years even. There are 6 hurdles to carbon monoxide safety. The first being equipment. Second is training and awareness. Third is that the alarms that we typically have in our homes and businesses, they warn too late. Their diagnostics is very difficult. There's no treatment plan, and we have an overall lack of accurate data on carbon monoxide poisoning. Just real quick, I want to walk through each of those 6 hurdles so that we're all on the same page. First and foremost, equipment. We just do not have enough alarms in any industry. Residential, in our homes, there's only 14% of homes in the US that have functioning CO alarms. Aviation, marine, in the boating industry, automotive, in our schools and daycares, even lodging, motels. We're going to talk, Patrick Smith from Risk our management is going to be talking about carbon monoxide poisoning in hotels and motels. And many of our first responders don't have the right equipment to protect themselves or the residents from CO poisoning. If we look at the codes around the state, 3 states have no protection whatsoever as far as CO poisoning is concerned, Texas being one of them. And if you're a Texas resident and you bore the brunt of the winter storm last year, you might know that there were more deaths due to CO poisoning during that storm than the actual storm itself. And then 39 states do not have any protection or building codes for hotels and motels. The second hurdle is education and training. There's a number of training classes for our first responders. However, there are very, very few training classes for carbon monoxide safety. And CO is a job hazard for first responders. It can affect their health, judgment, coordination, and aggression or temperament. Third issue with carbon monoxide poisoning is that our alarms warn too late. If you look at the UL standard 2034, which is what our home CO alarms are designed to, they are built to alarm when CO reaches a level of 70 parts per million after an hour to 4 hours. The World Health Organization says no more than 6 parts per million. And the World Health Organization has recently, a few days ago, updated their requirement or recommendation to only 4 parts per million. So we have a huge disparity between how our alarms work and the World Health Organization's guidelines. The Consumer Product Safety Commission tells us that these guidelines for the, they tell us that the home alarms are designed to save lives, not to prevent injury. So we can talk about what injury looks like when we talk about diagnosis. The way a doctor diagnoses most diseases are through symptoms, first and foremost. While carbon monoxide poisoning mimics other issues or other illnesses, it often looks like a hangover or the flu. It could look like depression or anxiety. COVID symptom, it basically shares every COVID symptom, and it could also look like the food poisoning. So if a doctor happens to believe that it could or suspect CO poisoning, they would write a prescription for an arterial blood draw. Now, there are some issues with this. A doctor has to write the prescription and you have to make your way to a hospital, even though less than 50% of hospitals have the ability to do this type of test. And you have to do it all within 4 hours of your last exposure, or else it will deliver a false negative and you will be returned back to your home or business for further poisoning. The fifth issue is treatment. Oxygen therapy is considered the gold standard, but there are several hurdles to it. The oxygen quickly removes carbon monoxide from your blood, but it pushes it deeper into your muscles and tissues. And there's an issue with brain damage that could increase after the oxygen therapy. And the oxygen therapy can also weaken already damaged tissue. And the sixth hurdle is data. We don't have enough consistent, correct data on carbon monoxide poisoning to fully understand the impact of this issue across the US. We do have National Fire Incident Reporting System, or NFIRS as we call it, and this is typically used by the fire departments when responding to calls, either be it a medical call or a CO alarm call. On your right, you would see the NFIRS form, and only 75% of fire departments use these NFIRS form. And it doesn't track individuals, it only tracks incidences, which leaves a lot to be desired. And then it also lacks detail, such as how many people were affected by the CO poisoning, the age, the level of CO poisoning, and those kind of details that would be very helpful. OSHA does provide some details, however, it's limited, and emergency departments only report the diagnostics or the symptoms, not the diagnosis of CO poisoning. So Patrick Smith. Patrick, are you on the line? Patrick is a founding member of REM Risk Management Consultants and focused on environmental health and safety. And he put together a few slides that might be very interesting. When we talk about NFIRS, NFIRS and the data is a very small portion of a large system. So the amount of details we're getting is few and far between. Patrick put together a list of all of the NFIRS data sets between 1999 and 2018 and looked specifically at the lodging industry in the US. Between those dates, there were over 3,000 CO poisonings in hotels and motels. And as you can see, the number of poisonings have increased throughout the years, typically because more fire departments are participating in NFIRS. You'll see this is a map of the CO poisonings that have happened across the US, specifically in hotels and motels. It's pretty alarming. And the health impact, we believe if you take a look at all the different data sets of incidences in hotels and motels, as we talked about earlier, there's 3,400 CO incidences in hotels and motels, but it doesn't tell us the injuries, the number of people affected. And based on extrapolation, we believe that there are between 650 to 1,500 CO deaths, poisoning deaths in the US and up to 40,000 injuries in hotels and motels. So a really, really important aspect of lodging is to keep our guests safe. And CO poisoning is an absolute critical issue. So how do we overcome multiple hurdles spanning multiple industries? We believe the only way to do that is to create a transdisciplinary coalition that focuses on eradicating CO poisoning. And because of that, we plan to have a summit kickoff in the spring of next year, and we welcome everyone's participation in the summit as we work to eradicate CO poisoning. And with that, I'd like to turn it over to Garnet Schulte and allow her to walk through a few slides.
Thank you, Sharon. Appreciate you inviting us to be here today. So again, my name is Garnet Schulte, and I work with Molex under the MPAC 2 division. SensorCon is actually a product line of ours. We are dedicated to making really durable and useful sensors. We manufacture, build, and test all of our sensors here in our Buffalo facility. Our sensors read up to or down to 1 ppm. So really we want to give a peace of mind, whether it's the organization, whether it's the employees, or whether it's just a consumer. Really just want to give them a peace of mind. As Sharon always says, without detection, we're just guessing, right? And that's a very good point. You don't really know unless you are taking a look at it and making sure that you are in a safe environment. So a little bit about our product here. This is called the Inspector. It offers visual and audio alarms on our basic model. We do have 2 other models, our Industrial and Industrial Pro unit. The Industrial also has a vibrating feature. The Industrial Pro feature allows you to program the ppms down to 5 ppms. Right now, they're factory set at 37 ppm. So once the CO level reaches 37 ppms, you will be notified, and that's obviously should be an indication that you need to do something about the situation you are currently in. They are water resistant and shock resistant. They will last up to 2 years without any maintenance. Of course, we do recommend every 6 months that you calibrate your unit just to keep the sensor sharp and to make sure that it's working correctly. We not only have carbon monoxide, but we also have H2S. And as I mentioned, our product is very well in the consumer market. We're very well established. We are Amazon's choice for carbon monoxide detection. We do well in aviation, HVAC, hospitality and travel, law enforcement, emergency responders, firefighters, and anyone that's looking to be safe. And the future that we're looking at and something that we're going to be releasing fairly soon here is called the Protector. So as Sharon mentioned, data is an issue that we want to try to help. We want to be able to capture data, be able to have our users understand whether it's their employees or themselves that are being exposed to. So this will be shipping by the end of the year. It is going to be a unit that will keep track of all your data. So anytime that you really any levels of CO are being read, that'll be stored. The unit that you see here, the docking station, will allow you to bump and calibrate your unit. It'll let you know when it's ready or needs to be calibrated or bump tested, which is a huge relief to people who feel like they may need to send in a unit or don't keep up on top of it. This will keep your unit sharp for up to 5 years. And as I mentioned, it's compact, it's lightweight, and it'll be able to keep all your CO levels. It'll track everything for many years to come. And we're hoping to make a difference with this product for carbon monoxide.
Thank you, Garnet.
Sure.
Sharon, do you want to present again? For some reason, you're not presenting.
Would you like to take it to the panelists?
For the Q&A? Okay,
Yes,
so the
sir.
first question will be for Roger, and I'm going to type the, I'm going to copy the question into the chat line. So if you click on the conversation button next to the smiley face with a hand, there will be a question come up. So Roger, you're the previous owner of the wildly famous New England restaurants, Legal Seafood. You have a tragic story relating to carbon monoxide and carbon monoxide alarms. Would you share your story
Yeah.
with us?
Sure. No, I'd be happy to. It was February 2014. My wife and I had just arrived at our apartment in New York. As I had mentioned before, we operated 30 restaurants in 9 different states. We operated in Long Island and New Jersey, so we were down there to visit and inspect those restaurants. Almost immediately upon arriving, I got sort of a frantic call about an incident that had taken place in our Huntington, Long Island restaurant. And I was getting bits and pieces, people taken to the hospital. Restaurant was evacuated, 1 person in critical condition. So, I said, get me the names of the hospitals where people are taken. I did hear something about carbon monoxide, but it wasn't exactly clear. I got to a couple of the hospitals where people had taken and spoken to some of the employees. And as I was piecing the story together, it became clear this is what happened. And it sort of relates, Charon, to one of your slides in that apparently there was a carbon monoxide leak in a water heater. And this had been going on for a week and a half. And it was in the basement. That's where the offices to the restaurant were. And the management staff, believed that they were coming down with the flu. And they didn't really think anything of it. Nothing seemed out of the ordinary. They were just feeling off. And it seemed those issues seemed to exacerbate as the week moved on. Now here it was Saturday. The assistant general manager was walking down the stairs to the office and collapsed, fainted. And the chef ran down to help her, and she seemed a little bit out of it. He immediately called 911. The first responders arrived, and all of a sudden they started to get lightheaded. And the first responders had to remove themselves from the facility. The fire department then arrived. They had the CO detectors and they realized exactly what was happening. They evacuated the restaurant at that point, and people were taken to the hospital. Now, I had mentioned before that 1 person was in critical condition. Apparently, that person who had been having symptoms during the course of the week made his way to a restroom. Unfortunately, it was the ladies' restroom, and he locked himself in there. So when people went to find him, they could not find him. He was locked in there, and no one thought of checking that particular restroom. When they eventually did, they found him unconscious. And he was rushed to the hospital where he eventually succumbed to carbon monoxide poisoning. This was a huge shock, to all of us. I mean, we had, as operators, I don't know why, but we naively assumed that there was some kind of detection mechanism similar to what you would find in your home that would alert to this. And unfortunately, as we found out, that there were no requirements, in the restaurant and hospitality that might have detected that. The next week was pretty much a whirlwind, speaking to folks and learning, much about it. I was contacted by the Massachusetts State Fire Marshal at the time, Steve Cohen, that asked if we would participate with them in discussing issues surrounding CO detection, particularly in the hospitality business. And we said, absolutely. I mean, we were shocked that this had happened because, sort of our background in the restaurant business has always been quality assurance. We set up a laboratory. We test our product. We have people going in and doing quality assurance tests. So this was part of our DNA, and yet we didn't understand CO. We did not understand the dangers of CO until we had this incident. So that was our experience, and that got us on the path of trying to advocate as strongly as we can, particularly to our industry, the need for CO detection. Steve, I think you're on mute.
Thank you very much, Roger, for sharing that. And the next question is for Kevin. You're the Michigan State Fire Marshal. Thank you for your service. You also created the MI Prevention, a community risk reduction program. What advice do you have for the fire departments when it comes to making carbon monoxide a higher priority within their community?
Well, thanks, Steve. Thanks for the opportunity to be here today. And yes, the MI prevention is definitely a statewide program that we have here in Michigan to address community risk reduction. And I think it was very early in the forming of MI prevention. In fact, it probably was even before we called it MI prevention. When I was appointed as the state fire marshal by the governor back in 2017, one of the initiatives was to reduce fire fatalities across the state. So in the process of looking at ways that we could reduce fire fatalities, Sharon McNabb had reached out to my office, and at the same time, she was trying to raise awareness in carbon monoxide poisoning at the same time that we were trying to reduce fire fatalities. And I think we hit it off pretty quick. Sharon helped us out in 2019 with a grant so that we were able to put up smoke alarms and carbon monoxide detectors. But more importantly, we found out that we have a whole lot more homes with smoke alarms than with CO detectors. So one of the things that we tried to do is we had families that had smoke alarms, but they didn't have CO protection. So that's where Sharon helped us down in the city of Detroit in Wayne County, helped us to put up over 1,000 units in different homes. With that, when it comes to fire departments, I think fire departments have really two issues. Fire departments are in a lot of communities across the country. They're the primary response agency to deliver EMS service or emergency medical services. So they're being dispatched to, hey, as Sharon shared in her slide, all of the slides, but probably the most common one I saw in my career and been in this business for about 37 years was, hey, we just don't feel right. We think we might have the flu. Everybody's sleepy. And those were the type of calls that we respond to as firefighters. Very similar to Aaron Rogers' story about the restaurant. The fire department responds, there's people sick, and start to say, hey, something's not right here, and try to figure things out. We've evolved pretty good with the fire departments having the CO monitors. So that when they go in, but what we're finding is that we still have a lot of homes across our state, and I'll say this across the country, that don't have CO detectors. That's an area we need to focus on as fire in the fire service. And further, one of the things that Sharon talks about is protect the protector. I think we need to make sure that every time fire is walking into any building, whether it's a home or a commercial building, on a medical call, is they have a monitor that will monitor for CO. With the idea that that would be going off, it's set to a very low level. It's going to give us an idea of, hey, what's going on immediately. So really, that's one of the goals that we have out there is that to get every fire department in the state of Michigan, and I'll say this, we're going to even rally for the whole country to have a basic, if you want to say, CO monitor, so they can monitor for carbon monoxide on every medical call or every time they make entry. And then further, we need to increase the number of units that are available for citizens also to have, so they have a early warning in their homes so that they can exit prior to becoming ill to carbon monoxide poisoning. Thank you.
Thank you very much. The next question is for you, Richard. You were legal counsel at Legal Seafood when they experienced a carbon monoxide poisoning event. Could you share the story from your perspective?
I'd be happy to, and I want to thank everyone for allowing both Roger and myself to participate in such a very important seminar to promote carbon monoxide safety. When we first discovered the incident, there were really three components of the response: a human resource response, a communication response, and a liability response. And most important was the human resource response. We deployed our human resource specialists to deal with the employees and address the needs of the employees. You know, a number of employees were sick. We had experienced the death of a general manager, and it was very important to offer our employees assistance and a forum to communicate and to grieve. The second piece was communication, and we needed to communicate in a clear, concise, transparent manner, both to the outside world and to the inside world. And a testament to our CEO, who was very upfront and out front in communicating the elements of the incident and what had happened. And that was critical in part of our response. And of course, the third part of the response is from general counsel, you have to look at the liability piece. And it was, you know, we had a team at the location. We had a construction person, we had an expert, we had to notify the insurance carriers, we had to preserve the equipment, we had to look at our insurance policies, we had to notify, we had certificates of insurance from the plumber who had done work on the equipment, and we had to send out those notifications and preserve the equipment because there was a lawsuit. There was not just one lawsuit, there were multiple lawsuits. One of the issues were the first responders who came and they suffered injury as well. And one of the things we did immediately, which was at the directive of the CEO, was to put carbon monoxide testing equipment in our restaurants. And the goal was to install, and initially it was a mobile unit within 48 hours of the incident. So by Monday, the incident happened Saturday night. By Monday, we had installed detection units in all of our restaurants, which we later converted over a period of time to hardwire. And then we developed a mitigation strategy going forward, which was every year, beginning in late October and November, we did a complete testing of that equipment. We hired an outside third-party service to come in and test the equipment to ensure that before the winter season, it was appropriate, it was used properly, and it had tested appropriately. And at the same time, we conducted an inspection of our kitchen equipment and our heating equipment and our water heaters that generated gas. And it really was a response, in addition to what Roger said, as promoting and creating an advocacy for CO safety because of the incident.
Thank you for sharing, Richard. Garnet, Schulte, the next question is for you. How will the features of SensorCon's carbon monoxide alarm benefit the travel and tourism industry and fire departments?
Absolutely. Thanks, Steve, for the question. So our units, this is the business that we're in, right, is to make sure that you know if there's any carbon monoxide near you or around you. That's what our inspector does. So especially when you're traveling, and I actually got this from Sharon. Sharon, we just traveled last month together, and she had her unit on her book bag, and now I carry my unit on my book bag everywhere I go. So anytime you travel, I think it's important to always be safe. And nowadays, especially with COVID, I think safety is a really big issue, and everybody wants to feel safe, whether you're an employer, an employee, a consumer. Everyone wants to feel safe. And I think with our units and our detection, it gives you a peace of mind, gives you that feeling that you are safe wherever you go. because you don't know when the last time maintenance was checked on, whether it's water heaters, for example, or anything of that nature. So it's always good to be protected. I carry my unit everywhere with me now, wherever I go, just to be safe. And I think it'll help consumers also feel safe. Now, as far as firefighters go, you know, the Protect the Protectors, it's a really great coalition that we're hoping to be a part of. And we do feel that we have to keep our protectors safe, right? There's the one that they're the front lines. They go in first, they check out the situation, and we want to make sure that they're covered. And with one of the obstacles being data, the new protector that's going to come out is really going to be able to capture that, so that fire departments and, for example, Kevin, you know, will be able to know where his firefighters are, what they are being exposed to on a daily basis. And that'll help us also communicate to government officials and things of that nature, so that we can actually prove that carbon monoxide is something that we need to pay more attention to, and we need to have the protection for everybody, whether it's you're in your home or traveling or you're a firefighter on the front lines. We need to make sure that everyone's protected from carbon monoxide.
Thank you, Garnet. And yes, I also started wearing a carbon monoxide monitor recently, and I've been quite surprised at the number of hits that I see. So there is carbon monoxide out there in the hotels. I travel internationally considerably, and seen a significant number of hits on the monitor, which I was very, very surprised about. So yes, I encourage everyone to wear a CO monitor when you travel, if you travel.
Well, remember the slide that had the map of the US and the building codes? There's a number of states that have zero requirements for hotels, motels, restaurants. And so you walk into a restaurant or a hotel assuming that it's safe from carbon monoxide, yet the owners, the managers, they don't have the building requirement to add a CO alarm, and most of those building owners, managers, they don't have the knowledge to know that CO alarms are required or needed to protect the people who are staying there. So yeah, I think it is a really great idea to carry a CO detector when you travel.
Yeah, thank you, Sharon. The next question is for Richard. You run a very successful hospitality consulting firm. What advice might you give a business that might believe CO alarms are too expensive to install and maintain?
Frankly, they're not expensive to install and maintain. That's number one. And number two, the consequence of not having one is such a great expense to your business that it should be without question that you would install and maintain one. I mean, the loss of life, the injury, the disruption to the business, to your brand, it should go without question, a no-brainer that you would install and maintain a CO detector.
I agree, and thank you very much. Kevin, how can fire departments get CO safety training and find funding to get the tools such as alarms and detectors?
Well, you know, I think one of the things that fire departments as a whole can start right even internally by going, and, you know, a lot of the discussion today has been on risk management, that even just going to the fire chief, going to the city, town, village officials to share that, you know, carbon monoxide is out there and that's why we need this equipment. So that's definitely a first place to start. There are grants out there. There's a lot of different foundations that have grants that are tied back to community health. And, you know, a big one out there is the Assistance to Firefighter grants, which is through FEMA. And the state of Michigan, we are trying to actually acquire one of these units for every single fire department in the state. We have 1,114. But that's a pretty competitive event or process that actually there's a lot of folks putting in for grants there, and the amount is limited. So, you know, I think we've got to look outside of the FEMA, the AFG grant as a funding source in the fire service. and look to some of the smaller community foundations and such. And I also will say this, that if you take it back to risk management, and I'll talk about it in the fire service, is that, you know, one firefighter having to go to the hospital for smoke inhalation or carbon monoxide poisoning or high levels of CO, the cost of that one visit is going to be much higher than if they had the units in place and could have protected their employees. So I think there's an obligation for the employer also to look at how do we make sure that our employees are protected 24/7, so that they can work in a safe environment.
Thank you very much.
Can I just add one point? Ruth Chris Restaurants had a carbon monoxide leak at their Pier 5 hotel in Baltimore back in 2010. They did not have CO alarms, and they were awarded, the restaurant staff of 20 was awarded $34 million because they were injured due to the CO poisoning. So it is really important to have CO alarms, especially from a financial, injury prevention, death prevention, obviously number one, but from a financial perspective, it's a good investment.
Sharon, based off of your experience, is this more a matter of awareness so that most restaurant owners, hotel owners just don't know that it's not a requirement and it's not part of the code and therefore it's not in place? They just believe that it would be in place? Or is it a matter of they're faced with the question of paying for the CO monitors, and since it's not a requirement, they choose to not do so? Is it an awareness issue or a decision and choice issue?
I think it could be both. I heard from a woman yesterday who put back a Christmas present, a toy for her 4-year-old, rather than purchase a CO alarm. So it could be both. From an awareness perspective, we're just people, right? And the general public doesn't have the awareness around carbon monoxide. It's not just business owners, it's the general public. And so thank you for the webinar and helping to get the word out.
Yeah, I assumed that CO monitoring would have been a state requirement, and quite frankly dumbfounded that it's not a requirement in any commercial business to have a CO monitor. That's definitely something that we can all work to address and hopefully change. Roger, after your experience, what is your number one recommendation for restaurants to prevent CO poisoning?
It's interesting. I suspect the number one thing that restaurants can do and hotels is really, and you touched on it earlier, it's really awareness. People are not aware. And we have certain trainings that have always taken place in the restaurant, choking as an example. Everyone is trained on the Heimlich maneuver. If someone goes into cardiac arrest, now there are defibrillators in many places, not all in restaurants, but people are aware that there are techniques and things that you can do while first responders are on their way. And I think, really up to this point, that it is not on anyone's radar of how important an issue is that this is. And I suspect that it's easy enough to get it incorporated into the training. And once people understand the dangers, behind it, and maybe it becomes something that, though this is obviously a year-round issue, that maybe one way of kicking it off. And I don't know, there may very well be. Is there any such thing as a CO awareness month? Is that out there? Because if not, perhaps doing a CO awareness month, say in October, when heating systems are typically fired up. At least, you certainly want to be aware year round, but at least it's a kind of a kick out scenario where people go, uh-huh. And then it's not just the restaurateurs that are thinking about it. Your guest base knows about it as well. And we can sort of encourage guest bases to ask the restaurants, what they're doing to mitigate in the case of. Put the onus, have the public put the onus, on the operators. And I think that would serve to move the needle fairly quickly.
Thank you very much. Kevin, how can fire departments partner with a NCOAA to improve carbon monoxide safety?
Well, I think, having these webinars like we're having today is, first off, we have to increase the awareness level. But I also will say this, that, the NCOAA has been very easy for Michigan fire departments to work for. And I know that they would welcome fire departments from across the country to be reaching out to them. I also know that, even amongst the state fire marshals, there's 50 of us across the country, is that, at a recent conference, there was more discussion about some things that we need to do to, as Roger shared, even for folks who are going to a restaurant, we need to increase their awareness. And, in the state of Michigan last year in April, we actually had the governor proclaim in the state of Michigan that it was carbon monoxide prevention awareness month, where we focused on that. I think some of the crossovers too, though, is there probably is a hospitality month that, actually comes from the restaurant side of things. I know here in Michigan, we have a great relationship with the restaurants associations, the food and beverage association. So there's a lot of different groups in each one of the states. But when we tie back to fire departments, I would encourage fire departments to get involved. Sharon and her staff will help you to get the information that you need. And it ultimately comes down to then getting out into the community and sharing the information. So that's really what community risk reduction is about. It's about how do we solve what are problems affecting health amongst all our residents. And every community is a little different, but we do have this one commonality. We need to be more aware of carbon monoxide, that's for sure.
Thank you. Garnet, can you explain more about ways to detect and prevent low-level exposure?
Sorry, it was talking on mute. Thanks for the question, Steve. Yeah, absolutely. Again, it's detection and making sure that you're aware of your surroundings. So being able to prevent any sort of carbon monoxide situations is to, as we've been talking all day, is to have some sort of detection, whether it's a house CO detector or whether it's a personal unit that you wear. There are quite a few options out there that you can use, but we're just big advocates for making sure that those units are working correctly in your home, making sure that you are always checking those and making sure that you have some other way of detection. So even if you do have a home detector, you should also have maybe a personal detector as well. Just so that you're always covered and protected in case one's not working properly or not working correctly, or need to change the batteries. So I would just encourage to take extra precautions and make sure that all your units are working, and that you have another personal detection unit on you. And Sharon, I don't know if you have anything to add as far as prevention goes, but feel free to.
Yeah, just once again, the home seal alarms are life-saving devices. They're not injury prevention. If you are going to purchase a home alarm, which obviously you should, try and get one that goes down to the lowest possible. I believe the lowest possible is 30 parts per million, but I truly believe that a personal CO detector is absolutely valuable because, World Health Organization says no more than 4 parts per million. And so a personal detector is the only way you're going to get readings as low as 4.
Yeah, and certainly COVID transmission is definitely related to the ventilation in a room. The more well ventilated the room is, the lower buildup of particulate, of all types of particulate, including aerosols. And therefore, anytime you have this buildup of CO, you're going to have a combination of CO and ventilation issues. It may be purely a CO issue, maybe a combination of CO and ventilation. So that's a very good point, Sharon. And when you're buying the alarm, make sure you buy the best alarm with the lowest possible detection or alarm threshold.
And then I just want to mention that we recently released a white paper that details the rationale for purchasing low-level alarms, and also to encourage people to take the time to understand low-level CO safety, and the ability to communicate that to your community, your family, your friends, your colleagues. So this white paper is available for download on our website, and we'll send out the link to the white paper with the thank you note.
Thank you. And are there any natural sources of CO, or is every time you have a CO concentration of 30 ppm, then action needs to be taken?
That is a really great question. So most people don't know this, but our bodies naturally produce carbon monoxide. In times of stress and sickness, it produces carbon monoxide levels higher than if you're healthy and not sick, or not stressed. So the problem is with exposure to CO at any levels is that your body can't tell the difference between what it produces naturally and what it breathes in from the environment. And so there are really no levels of healthy carbon monoxide to breathe in. And so, I mean, that's really the point.
Yes. Okay, thank you. Thank you. And thank you to all of the speakers and the panelists. Thank you for your time and your dedication. We want to recognize, value, and appreciate your efforts towards carbon monoxide awareness, how valuable that is to the community, to the world. And just want to thank you very much for your time and your effort and all that you do towards carbon monoxide awareness. And with that, that concludes our webinar for today. Thank you very much for your participation. And if you have questions, you can go to the National Carbon Monoxide Awareness Association, and you can download the white paper here as shown on screen. Thank you very much.
And Steve, there will be a recording available, correct?
Yes, absolutely. This recording
okay.
on YouTube.
And okay, thank you so much. And we'll populate the video on our YouTube channel as well.
Yes, and there will be contact information there at the same location of the YouTube video. Okay, thank you very much, everyone, for participating today.
Thank you.
Thank you.
Bye now.